When a person presents with sacroiliac joint pain, sometimes it's bilateral, sometimes it's only one side, and sometimes it's accompanied by pain in the pubic symphysis. And as we all know, the pelvis consists of a ring with three joints, two in the back, the SI joints, and the one in the front. Now the pubic symphysis is not necessarily a synovial joint. It's more of a fibrocartilage joint, but it will cavitate if it's adjusted properly, and the adjustment for that can be extremely beneficial for those who need it. Now, it is a pretty rare occurrence that a person needs something like this, because even when a person does present with pain in the pubic symphysis joint, usually adjusting just the SI joints and the lumbar spine will alleviate the problem. But when you palpate the pubic symphysis, like let's say that you've taken the patient and you're not getting that much success and they continue to have pain in the pubic symphysis, when you palpate it, if you just take your fingers apart like this and check to see if one side is higher than the other, check to see literally if it's a little bit crooked or malpositioned. Of course, the bones can be very anomalous, and there can be variations in how much tissue is here, but palpating the pubic symphysis can sometimes give you some idea as to whether or not it is actually malpositioned or subluxated. So, of course, this is something that you need to discuss with your patient before you go in and start palpating. But if you do decide that adjusting the SI joints alone isn't doing the trick and the patient's complaining of pubic symphysis pain, the adjustment for that is actually quite simple. It is one that requires an extreme amount of speed and skill, and happily practicing on the Dynadjust for this adjustment is especially beneficial. Okay, now after you've given a thorough explanation of what you're going to do with maybe your plastic spine and explaining what the patient might expect here, the adjustment's really pretty simple. Basically what you do is, I've got Maria's feet braced against the back end of my table here, and I think that's very important. If you don't have this kind of table with a sliding foot piece, you can use a strap around the top of the feet. So I would have the patient like this probably, and just put a strap here to help stabilize the feet. But in this case, I've got the footrest stable there, so she's just resting her feet there. I put one hand on the top of the knee with the patella right in the palm of my hand. The other hand is like this. You can also do it like this, whatever's more comfortable for you. If you prefer to push rather than pull, that's your choice, but you're going to be doing equal pressure on both sides. So in this case, I'm going to be pushing with this hand and pulling with this hand. And so to effect the adjustment, basically, you ask your patient to squeeze the knees together as hard as she can. Try to squeeze your knees together, give it as much force as you can, allow the knees to approximate so that your hands are touching. Now continue to squeeze, please. Just pretend like you're going to crush my hand there, and then the manipulation is actually a sudden blast of speed, just as fast as you possibly can, like so. And probably about half the time, maybe more than that, you actually will get a cavitation in the pubic symphysis. Now, if the person is asymptomatic, like Maria here, that cavitation is not painful, it's just more of a surprise. But if there has been some malposition there and that area has been sore for some time, this adjustment might be a little bit painful. Certainly nothing to be worried about or concerned about, and the pain would usually subside very, very quickly. But cavitating that joint is not the most comfortable chiropractic adjustment.